As the COVID-19 pandemic continues to be a threat to Uganda and claiming more lives of people suffering from non-communicable diseases, Uganda Non-Communicable Disease Alliance has today launched a project which will support people living with such diseases to enable them get involved in the NCD and the COVID-19 prevention and control programs. There's more to this report.
According to the World Health Organization and other experts, people living with non-communicable diseases in Uganda stand a high risk of dying of COVID-19, but little attention has been given to such a population.
People living with NCDs are believed, are considered by WHO and indeed other experts to be more vulnerable and more susceptible to COVID-19 complications and even death. But little is being done deliberately to protect them or even to manage them. We have a number of COVID-19 response teams, or call them task forces, at various levels in our country. But people living with NCDs are not represented at any.
It's on these grounds that the Uganda Non-Communicable Diseases Alliance have decided to launch a project funded by the Global Non-Communicable Disease Alliance by supporting people living with these diseases to get involved in the COVID-19 prevention and control programs influencing policy and decision-making in Uganda by February 2022.
We would want people living with NCDs get involved in NCD prevention and control activities in the era of COVID-19.
Christopher Kwizera, the Uganda Non-Communicable Diseases Alliance Executive Director, says that the project will be set off in Sere, Luwuka, Toro and Nakasongola because these are the districts that are having more numbers of people with non-communicable diseases. However, it will later be rolled out to other districts.
The reasons we are going to these are districts that Uganda NCD Alliance has been working in, and this fund was small and brief for a short time, 6 months. And we also know that these are the districts that are specifically more organized in NCDs, and they have bigger numbers of the people based on the information that we have gotten from them as we continue practicing, working in those districts. Now, we are just starting as a pilot. We shall roll out to other districts as funds keep coming in.
Kwizera, however, notes that government should ensure that every vaccination center has somebody who will be doing the screening of persons with non-communicable diseases like cancer, heart disease, diabetes, amongst others.
We would want that at every vaccination center there is an effort, or there's somebody who is strictly screening people living with NCDs, or even giving them care and advice.
Uganda Non-Communicable Disease Alliance states that persons with non-communicable diseases have much been affected by COVID-19, and some have developed complications. Others have fear visiting health facilities with fear that they may contract the disease.
So they could not also access their medicines, they couldn't also take their medicines, so they have developed the complications of their diseases. In the recent times, the doctors and the clinicians who are managing them are actually managing complications other than the diseases themselves.
The story was filed by Julius Muhumuza for Dream TV News.
Thank you so much, Julius Muhumuza, for that report.